Hello and welcome to another ECW podcast. I'm Brian Saal, and today we're broadcasting live from the ECW National Conference here in Orlando, Florida. Joining me today is Dr. Jordan Stern from BlueSleep, the founder and Chief Medical Officer in Manhattan. And thank you for being with us today, sir.
Thank you for inviting me. My first time here.
I'm hoping you're enjoying it.
Very much.
Wanted to talk to you a little bit today about the new advent of wearable medical devices. We know about Fitbits and so forth, but before we do that, can you tell us a little bit about your practice?
So the BlueSleep practice in New York City is a practice dedicated to the diagnosis and treatment of sleep apnea and other sleep disorders with an interest in technology and new technology and making it as easy as possible for patients and their families to be diagnosed and treated. So we've been using home sleep testing technology for about 15 years. We've done over 10,000 home sleep tests, much easier to get a study in your own home. Also 10% of the cost of a sleep study. And we're also very interested in wearable technology and sensors and how they can play a role in increasing the number of people that are undiagnosed and that do have sleep apnea. Probably in the United States, we're looking at 50 to 100 million Americans that have sleep apnea, and 90% of those are undiagnosed. So all about making it easy for diagnosis on a large scale. We also do minimally invasive procedures for sleep apnea in the office, and we have dentists that work with us, and we make oral appliances for the treatment of sleep apnea. So comprehensive treatment for obstructive sleep apnea and evaluation of new technology, including consumer technology such as wearables and sensors.
As someone who has sleep apnea myself, my doctor has told me consistently that it's not only a problem with being tired, but it contributes to a lot of other chronic illnesses that can be.
Absolutely. So, what's exciting for me to be here at eClincialWorks is to meet practitioners in other specialties and being able to discuss with them the fact, as you say, that undiagnosed sleep apnea contributes significantly to high blood pressure, to diabetes, to anxiety and depression, and overall significantly increases the cost of healthcare for those patients that are undiagnosed. Let me give you a couple of numbers. It's been estimated by a Harvard study, and already 6 years ago, that the burden to the U.S. economy of untreated sleep apnea is $160 billion with a B, dollars per year, whereas the cost of treatment would only be 10 to 12 billion.
Wow, those are some amazing numbers.
Yeah.
So we were talking about wearables, and in particular you were mentioning wearables for not diagnosing, but seeing the beginnings possibly of sleep apnea. Can you talk a little bit about that particular device?
Yes. So wearables have become very popular, and they've been used primarily for the activity wearables for weight control, for exercise evaluation.
The Fitbit, for example.
For example, the Fitbit is a very well-known wearable. They purport to evaluate sleep. They really evaluate movement, so they may be able to tell you when you've gone to bed, when you've woken up, but they won't give you information about the quality of the sleep, and they won't give you any information about the likelihood that you may be suffering from sleep apnea. Now, they are not medical devices, so that's not their role. However, there are some sleep sensors, and one of them that we've worked with and we've been able to bring into healow, so that the eClinical physicians can access the data, and that sensor is called bedded. It's not really a wearable because you don't wear it. Okay. It's placed on your mattress, and every time you go to bed, it starts picking up data from the hours that you're sleeping, the quality of your sleep, and it also picks up breathing, so it can tell you how well you're breathing and if you stop breathing. It, again, is not a medical diagnostic test, but it can help raise awareness among the users as well as the doctors. And what's very exciting is that this is the first consumer sleep sensor that's been integrated into an electronic health record system through healow. So it makes it very easy for that data to have some meaning. Because the problem with wearables and sensors is that they're there and people look at the numbers. The question is then, so what? So in this case, it's, hey, we can show this to a doctor who's using eClincialWorks, and that information can actually come in to the electronic health record system and be used to raise the question that this patient may be suffering from sleep apnea. The next step would be to refer that patient to a sleep specialist. I'd like to mention something else that we've used with eClincialWorks is telehealth and telemedicine. There are not enough sleep doctors in the United States. There are not enough sleep centers to identify, diagnose, and treat all the patients suffering from sleep apnea and other sleep disorders. And so being able to evaluate patients through telemedicine and telehealth is something that we've just started doing using the eClinical system, and I think that that'll be another great improvement to try to identify those that are suffering from sleep apnea, for example.
That's fantastic, because with so many different specialties, there are just such a limited number of specialists in those areas that telehealth really does really be very, very helpful. To go back to the Bedded, I actually had the opportunity to go to their site here at the conference. And while we were talking about how that information can be fed directly into eClinicalWorks, which is obviously a fantastic step forward, I was really fascinated by what the consumer got out of it. The number of graphs and the amounts of information that were provided on your phone directly in front of you. Really fascinating stuff, and it's inspiring. It inspires you to take action for your own health.
Yes, the sensors and the activity trackers, that's the first thing they do. They kind of raise awareness, and they get you motivated to do something. Interestingly, most people stop using them after 3 months. So what's great about this sensor and the connection to eClinicalWorks is that there are continuous data that are transmitted into healow and eClinicalWorks when the owners are using these devices. Bedded is very forward-thinking in there. They have created a sleep report that can be generated from this. So not just individual numbers, but a 2-week report of sleep, and that could be made available to the primary care doctors and to sleep doctors as well. So not only a curiosity of your sleep, but these are things that you can do based on this report. One of the other things that we do at BlueSleep is we provide sleep coaching. It's not a medical service, it's a sleep wellness service, and it allows us to, throughout the United States, in fact throughout the world, be able to advise people on better sleep, better habits, and raise the possibility that they may be suffering from a sleep disorder.
You mentioned earlier that you've been using wearables, if you will, for 15 years, and that you're using telemed now, et cetera. So it seems that your practice is very, very cutting edge with technology. One last question for you, and that would be, where do you see this type of technology going in the future, and how do you see it affecting both providers and patients?
I would say that this year is a pivotal year in terms of consumer technology actually coming into the consciousness of the medical providers and through, for example, a portal through eClinicalWorks. I had the pleasure of meeting Melissa Alexander, who did the project with us of integrating Bedded into eClinicalWorks. And I met her at a conference called Health 2.0. And Health 2.0 is a digital startup group and conference. And this year, they seem to all be asking the question, we have cool technology, But now, what do we do with it? And this is the first year that I heard them pose that question. And I think the answer is, let's use that technology. Let's see how it can raise awareness, not only among the patients, but also the doctors, for example, that sleep is important. And what can we do about it? So I think that integration of consumer technology with the electronic health record system is critical. One of the other things I want to say is that when Girish and Dr. Raj talked about safety and patient safety, at another level, at a different level, sleep impacts patient safety by improving the likelihood of diagnosis of undiagnosed diseases, right? So I would say that that's improving patient safety. At the same time, better sleep helps people drive safer. It decreases accidents at the workplace. Last year, there were 1,500 fatalities related to drowsy driving, 77,000 injuries, $40 billion worth of medical costs. Now, if through the trackers we could raise awareness of how important sleep is to your health in general, that's another area where we can improve safety and really make an impact on a very large scale.
Thank you very much for joining us here today, Doctor. This was a fascinating interview, and I really appreciate your time. And I'm glad that you enjoyed the conference.
My pleasure, yes, and I will be coming back.
Great, thanks. We'll see you again next year then.
Sounds good.
Thanks for joining us. Please join us again. And remember, you can see more of our podcasts on iTunes, YouTube, and my.eClinicalWorks.com. This is Brian Saal. Have a great day.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.